Guys, welcome. In this video, let us look at this case study. Farmer, aged 40 years, presented with generalized weakness, cough, expectoration and wheezing. So he is having some wheezing, cough with expectoration. Hemoglobin is 11, borderline anemic, you can say. WBC count is slightly high. Platelet count is normal. Neutrophils are kind of less. Eosinophils have increased. Then, what do you say? Eosinophils have increased. Neutrophils have decreased. In the peripheral smear, they are showing that there are too many eosinophils. So it is eosinophilia definitely. Now what are the favor in diagnosis? You can say eosinophil count has increased. And this, here you can see eosinophil count has increased. Peripheral smear also shows eosinophil counts are more. Then what do you think is the problem here? He has wheezing. Okay, so what is the cause of above condition? Eosinophilia. Eosinophilia refers to increase in eosinophil count. Okay, if its absolute count is greater than 500 per microliter. So what are all the causes? Allergic conditions like asthma, bronchial asthma and hay fever. All these are the causes. Parasitic infestations like hookworm infestation, roundworm, tapeworm. Parasitic infestations like worms like tapeworm, hookworm, roundworm, right? All these infestation. Skin diseases like urticaria, then scarlet fever. Okay, all these are the causes of eosinophilia, that is increased eosinophil count. What is this? Increased eosinophil count. How exactly they are going to say? Above 500 eosinophils per microliter. Okay, increased eosinophil count. Now what is the normal eosinophil count? Do you know that? Usually it will be only 2 to 3%. Okay, here it has become how much? 15%. Normal should be only 2 to 3%. So normally it will be around 2 to 3%. Okay. So if there is an increase above 500 per microliter, the cause can be allergy, parasitic infestation, skin disease like urticaria, scarlet fever, etc. Some other causes you should write like malignant diseases with metastasis, irradiation. Then Loeffler's syndrome. Loeffler's syndrome. What is this? Loeffler's syndrome. Same thing like parasitic infestation only, in that eosinophils will be there in lungs. Eosinophils in lungs due to parasitic infection. Due to parasitic infestation. Okay. Then, what are the other causes? Eosinophilia. Pulmonary infiltration with eosinophilia, PIE syndrome. That only is Loeffler syndrome. No. Pulmonary infestation. Pulmonary infiltration. Same thing only, right? Tropical eosinophilia, hemopoietic diseases like CML. Malignant disease. That only, right? CML. Polycythemia vera. Polycythemia vera. Pernicious anemia. What is pernicious anemia? Where there is decrease in the red blood, RBC count itself will reduce. Pernicious anemia. That time there is no vitamin B12 or something. Actually, pernicious anemia is where intrinsic factor is less actually. Then polyarteritis nodosa, rheumatoid arthritis. So many causes they have given. What are the causes? Polyarteritis arteritis nodosa, rheumatoid arthritis, etc. All these can be causes of eosinophilia. Okay, right? Moving on. Just a word on eosinopenia. Eosinopenia. That is less number of eosinophils. Let's have a word on that also. Basically, if the person is taking adrenal steroids, ACTH, they induce eosinopenia. Here they are saying even stress can reduce eosinophils, even some infections can reduce, acute pyogenic infections can reduce eosinophil count. They are saying after splenectomy, the eosinophil count will increase. So we'll write that also here. After splenectomy, the eosinophil counts will increase. So we are done with this case study. Basically here, we have looked at a case where there are, in the peripheral smear, we can see a lot of eosinophils. Eosinophil, normally 2 to 3% should be there. Here 15% is there. So diagnosis is eosinophilia. 2 points in your favor is this and this. And also he has some wheezing, so could be some asthma. What is the condition cause? Cause we have mentioned here. Causes are like allergy, parasitic infestation, because eosinophil's job is to fight allergy, to fight parasitic infection. That is the job of eosinophil. So it has skin disease. I mean, if there is skin disease, scarlet fever, malignancy like CML, polycythemia vera, then pernicious anemia, irradiation, Loeffler's syndrome, pulmonary infiltration, polyarteritis nodosa, rheumatoid arthritis, splenectomy. Okay. Right here, pernicious anemia, that is intrinsic factor deficiency. Intrinsic factor deficiency. Okay. So that's all in this video. We will meet you in the next video. Bye bye.